Thank you, Madam Speaker, and I would yield myself the balance of the time, as much time as I might
The gentleman
consume.
is recognized.
Madam Speaker, first of all, I want to thank our leadership in our committee. I want to thank Mr. Pallone, Ms. McMorris-Rogers, Mr. Guthrie, and obviously Chair Anna Eshoo for moving this, and our staffs for moving this legislation forward. This is a very important bill. All of our healthcare workers, particularly in this COVID pandemic, are really heroes. They are, without exception. All of us know many of these workers because they're our neighbors and friends. And each of us have heard those cries of woe as they have done their job every day, day after day for 24/7. I can't imagine how they do it. Watching so many folks suffer as they try to help them from their hospital beds. Passing on the sad words that they passed away to family members, maybe not even in person because of this terrible pandemic. And thinking of the hundreds of thousands of Americans that have died because of this awful disease, let alone so many more across the globe. Well, one of those healthcare workers was well publicized at the time was Laura Breen, physician from Charlottesville, working on the front lines of the pandemic in New York, moving up there to try and help the need. And yes, as it was mentioned, took her own life. This was a national story. It gripped the nation. I can remember watching the news shows that week as this tragic story was portrayed. It outlined the severe stress that this pandemic has put on our healthcare workers and the need for the resources that they need to help them cope. The demands that our healthcare heroes are facing, they've not changed. They haven't changed yet, for months, for a year and a half. They've been asked to care for communities in my district in Southwest Michigan and across the country 24/7 as the pandemic continues. This bill helps us have their backs. I talk to major hospitals in my district every week. And the common refrain that we've been hearing throughout the state of Michigan is that our hospitals are still strained to their breaking point. Staff shortages are severe. I saw a story a few hours ago about, I think the state of Maine is now taking up their National Guard. We've asked for national help from President Biden as well in Michigan. There have been too many examples of healthcare workers that are suffering from this enormous pressure as they fight the worst public health crisis in a century. This legislation is going to help promote mental and behavioral health for those healthcare professionals, improving their overall well-being, and maybe even saving their own lives. This bill helps promote mental and behavioral health among those working on the front lines of the pandemic. It supports training for health professionals to prevent suicide and burnout, and it increases awareness about suicide and mental health concerns among their peers. So I'm glad that we're considering this important bill. We'll vote on it yet tonight. I look forward to having it being signed into law. And again, I thank the bipartisan cooperation on both sides of the aisle. And hopefully we can get our Senate colleagues, and I know that they're with us on this, to work together to get this bill to the President as soon as we can. We can't wait another day. I reserve the balance of my time.